You're about to review Full Note Composer for a nurse or a clinician before the actual provider starts to see the patient. What this is going to typically entail is this is going to be going over when the patient first comes in, who's that first person that actually takes that patient back in there? Do they typically get the vitals, maybe chief complaint, history of present illness? So what we're going to do is we're going to actually go through that. There's multiple ways to open up a new note, a new chart note, or what we call Full Note Composer. But the easiest way to do it is truly from the desktop, under the patient name, the second icon will open or create a new note. Alright, so this is going to open us up directly into what we call our Full Note Composer. Now, one of the big things that you always need to be talking about and always should be pushing is that we don't actually use templates in this system. Okay, so one of the new latest and greatest pieces of technology is using what we call this knowledge database. So what I mean by that is you're not going to see any type of drill downs. You're not going to be able to have a separate program called Template Builder. Everything's built so you can do it directly from the screen and you can create content on the fly. As a nurse, when I first open up this screen, you're going to see it's very simple to how they probably typically see patients and document a chart note. They're going to probably take their vitals first, then they're going to move on to their chief complaint, history of present illness, and even take some history. If I'm maybe in orthopedic practice and I don't take vitals, I can even have this tab actually default for me to skip right over my vitals. But let's actually go through a typical visit. Let's say that the patient's coming in and Donald comes in there. Here's where we can actually put in what the weight is, and then we can put in the height for the patient. You will see it automatically calculates your BMI. We can come in here and you can fill in some of the other vitals that we have. Now, based on where you have this method and condition, all of these fields can actually be defaulted for each nurse. So if I'm a nurse, if I always take the blood pressure and the left arm sitting, I can have that default for me compared to if it's maybe right arm standing. As I enter in my vitals, once I'm done, I can update my vitals and it will put those appropriate information up at the top. It also gives me the ability from here where I can go in and maybe I want to track their vitals. So here's where I could end up doing growth charts if I wanted to, or I could even maybe just graph the results if necessary. After I get done entering my vitals, I can move on to my chief complaint. Whenever I come into my chief complaint, here's one of the things that we're talking about truly is it's not a template system. So what I mean by that is here's where I can come into whatever the patient's actually coming in for. Let's just say maybe they're coming in for a headache. We can come in here and we can find our neurologic. Once we pull that up, here's where we're going to see a list of all of our content that we have. So if we set that it's a headache, we can come in here and we can select that information. If we accidentally selected an incorrect one, maybe such as dizziness, if you want to get rid of it, you truly just select it again and that will remove it automatically. Now within this note, you also have the ability where you can add some free text. So here's where maybe if the headache, you want to add some specific things, typically in the morning. You can do that. You also have the ability up here where this is going to show the first part of the chief complaint. You can have even macros. This little notes icon have some information pop up there. As we get done entering in our chief complaint, okay, so it's very simple to add in our chief complaint. We can go to our HPI. So the first main point is that we don't have templates. The second thing that we want to talk about is that this system has intelligent navigation. And what I mean by that is it actually provides only complaint-driven information. In a template world, if you come to the HPI, here's where if I have a general template open, I'm seeing HPI for broken foot, headache, rash, acne. In this system, everything, all of this information down below is only pertinent to headache. So here's where I can come in here. I can actually say maybe it's towards the frontal area. We're going to say that it's an acute headache and it's gradual in onset. So I'm truly, just like reading a book from left to right, I can go in and I can select the appropriate information. If I want to go to my frequency of episodes, we're going to say that it's typically daily. They last, we'll say right around 30 minutes. And we'll say that the timing episodes predominantly in the morning. As I'm documenting all this information, you will see down at the bottom it says 4 points charted. This is going to be very important when the provider takes over, because when the provider finishes that visit, we have something called an evaluation and management code, which is going to help make sure that the provider is billing at the appropriate level. Once the nurse gets done filling in the history of present illness, here's where they can come in and they can enter in their history information. Now, one of the nice things about history is once you typically enter in it once, it's always going to stay the same. You might have additional fields you have to add, but history is not going to change. You'll see right here that surgical history is already blue. This means that I've actually already entered it, and you can see that we've documented that the patient has had an appendectomy 5 years ago. This was just from a previous visit that we documented this. Instead of us selecting that over and over again, we can truly just put a little checkbox in there. And what that said is it says that we've reviewed the surgical history, and now it's going to give us that appropriate documentation. If we want to come in here and we want to maybe add the social history, here's where we can talk about Donald Duck. Maybe Donald's married, has a couple different children, and then here's where you can talk about their employment. So you can go in here and you can fill in all that documentation. For the most part, in a typical visit, this is what a nurse is going to document. It might be a little less. It could actually be a little bit more. They could go into the review of systems. But what we want to talk about is how do we get that note to the provider? So from this point, now that the nurse is done, the nurse can actually come into their note and they can close this note. Once they close this note, here's where they have the ability where they can just send it to the doctor. So I'm going to say that the super bill is still not ready, and I'm going to check my OK little button right here. And what that's going to do now is that's going to take me right back to my desktop, and I can come in here and I can change the status of Donald Duck's appointment to waiting for the doctor. We'll say room 1. And that's going to conclude going through the nurse's visit.